All right, so Michigan fan.
Mm-hmm.
Mm-hmm. Do you watch sports much?
Mm-hmm.
Okay. What at the collegiate level are you a Michigan fan, or do you have any allegiance at all whatsoever to Florida? Or
if it's like 1 and 2, so Michigan is number 1.
Yeah.
I'm going to root for Florida, but if I had to pick between the two of them, it'd be Michigan.
Okay. All right. That's fair. Having a pretty good season.
Mm-hmm.
Some interesting conversation going on right now with the whole
I don't
signal
know.
gate or whatever, whatever they call it. I don't either.
Not for
Indiana.
Noise, fake news. I don't know.
Oh, okay.
You have a big game coming up.
Yes.
Not necessarily this weekend at the time of this recording. I'm not sure when this will get released, but do you partake in watching the Michigan-Ohio State game every year?
Absolutely.
Yeah.
Mm-hmm.
Yeah.
And
That's
do
a
you
big
have
deal.
any Ohio State friends that you have?
I
standing
do.
wagers
I went to
with?
high school in Ohio, so a bunch of my friends went to Ohio State. I haven't spoken with them since.
Poor
but
kid. Nice.
Former friends. Former
Exactly.
friends, right? Yeah.
But I see them on Facebook. And
Yeah.
we
All
met.
right, cool. Well, that'll be a good segue. Let's lead into the intro and then go from there.
Yeah.
Cool.
Sounds good.
All right. Is this thing on? Hey guys, welcome back to another episode of the Summits Podcast. Thank all you guys for joining us from wherever you get your podcasts, or if you're joining us on the Heroes Foundation YouTube channel, thank you for doing so. All right, folks, get your mental caps on. We've got a great guest today, Dr. Natalie Dattilo. Natalie, welcome to the Summits Podcast.
Thank you. Happy to be here.
Why don't you give us a little background on yourself?
I love this question. My anxiety shoots through the roof. Well, I am a psychologist, trained as a clinical and health psychologist. I've been in practice for about 14 years, primarily just academic practice, which means I've been working in departments of psychiatry, first at IU and now at Brigham and Women's Hospital in Boston.
Okay.
And I've been doing that, I said, for about 14 years, off and on, with some private practice thrown in, some consulting thrown in. I like to do a little bit of everything, so I try to keep busy. Lately, what I've been doing is speaking about mental health. I'm a mental health advocate. I like to educate, and so any opportunity that I have to talk about mental health issues and sort of spread that information, I'm going to take it.
Yeah. Have you done any interesting or unique speaking engagements by doing that through education or anything like that?
I speak to the media quite a bit, which I enjoy. I've been doing
Speaking
that
of
for
mental
about
health.
10 years.
Yeah.
Right.
Yeah.
Sorry.
So I get requests for comment on all sorts of topics related to mental health, whether that's mental health research or treatment. And I love speaking with journalists. I was a local spokesperson for the American Psychological Association for a period of time. So a lot of those media requests would come to me, and I would field them. And I used to drive around in my car with a blazer, so I would look very official. Like a moment's notice, I could just set myself up for an on-the-spot interview. And I think that came in handy once, but I really wanted to be prepared.
Yeah.
But that one time was awesome.
Yeah.
I really nailed it.
That one time made it worth all the times that it sat in the back of your car, right?
That's right.
Yeah.
So I was doing live broadcast interviews. That was just a trip. A couple of times I've done that. Since COVID, it's been all by Zoom.
Okay.
And there was one time where I did a Zoom interview, and I think it was with Good Morning America, and I can't remember. I should remember that. But the screen was blank. I could only hear the broadcaster, the producer in the background, and and there was a question asked, but I didn't know it was being asked to me because I couldn't see the interviewer. I couldn't see the anchor.
Yeah.
And I just sat there. It was like dead air. They fixed it for the West Coast broadcast, but they're like, "That's you," and I'm like, "Okay."
Hello.
Mortified.
Yeah.
Bueller.
Wow, she's really thinking about this question. I didn't realize it was so heavy hitting.
Where did we get her from?
Well, that's cool. In some prior conversation, we were talking about growing up. You've moved around a bit, mostly in the Midwest. Grew up in Ohio. Spent some time in Michigan. University of Michigan grad. Go Wolverines. Did I just say that?
Go Blue.
You did just
Go
say
Blue.
that.
That's probably more appropriate.
Yeah.
Then what? So you went to Florida then for
Graduate school.
Graduate school.
I was in Gainesville I lived in Florida off and on for about 8 years. So I was in Gainesville and then Tampa for a bit, where I worked and did some consulting work for a company down there called Navigant Consulting. I got 2 master's degrees along the way, and this is not because I'm trying to no. It was because my path was just not a very straight line. So I started in grad school for psychology, and then I got really interested in mental health policy, health research, health services administration, and I wanted to really study that more. So I got a master's degree in health services administration. Okay. Along the way. And I thought, well, maybe I'll just use that. Maybe I'll just go work in health policy and health services research. And I got a job with a company that did healthcare litigation consulting. And it was a great job. I was mostly just doing data analysis. Okay. But I worked for lawyers who represented insurance companies who were trying to get out of paying part of their contract with the hospitals or the providers. And I was like, wait a second. Maybe this isn't my calling.
Yeah.
And I decided at that point I really did want to finish my degree in psychology. So I went back, finished my dissertation, and I've never looked back.
Nice.
At what point, or maybe that was the point, but at what point did you say, okay, I want to work with patients directly versus the admin side?
Well, that's a really good question. I've always really liked working with patients, with people. When people ask me, why did you get into psychology? I like to tell them it's because I like helping people, which is true. It's very true. But really, I was just very curious about people. I wanted to understand better why people do what they do and better understand behavior. And then, and I wasn't always sure that I was going to be a clinical psychologist. And then really enjoyed also working with people who were struggling to help them feel better, get better. And then I also enjoy working with people who are doing quite well and also want to do better.
Yeah.
So,
good segue. We could probably go 2 different paths. One path would be maybe a different podcast, but the path about folks struggling. So as it relates to cancer, we were talking about this a little bit beforehand. A cancer diagnosis affects people mentally, not just physically.
Yeah.
Let's touch on that a little bit. You've spent some time working with cancer patients. What kinds of things did you notice, and what kinds of things did you work on with cancer patients to perhaps try to help them with the whole their mental capacities?
So I was a psycho-oncologist at IU, the Simon Cancer Center, for a period of time when I was working in Indy full time, and would work with patients who were newly diagnosed. So they had just received their diagnosis, or they were in treatment or post-treatment. And all those different phases can affect a person differently. And so, but there's a lot of distress because there's a lot of uncertainty. There's a lot of unknown. There's a lot of anxiety associated with receiving the diagnosis, going through the treatment, which can be, very unpleasant. And then after that's over, you might not think there would be as much anxiety because we made it, but there is. In fact, I think sometimes there's more. And I think we had mentioned that, any little thing that you notice in your body becomes very, very, very focused on it and begin worrying and wondering and what-ifing. So there's a lot of talking through those fears, those anxieties, trying to come up with tools and strategies for managing that, because it is important. How you're functioning mentally is going to affect how you're functioning physically and how well you're tolerating the treatment, how well the treatment is working, and how optimistic you feel about the future.
Right. Are there any recommendations you would give for someone going through cancer now, going through treatments, probably going through various highs and lows from a mental standpoint? Any advice you might provide to them, and or maybe the caregivers who are working directly with them to help work on the attitude piece?
Well, one of the techniques that we use comes from a type of therapy called acceptance and commitment therapy, or ACT. And what that therapy teaches us is that acceptance is a really key part of this process for maintaining mental well-being and an optimistic outlook. And I'm say a little bit more about how those go together. And we really have a misunderstanding in the word itself. It's the first thing we need to clarify, which is an acceptance of something is not a giving up or a giving in or a resignation to like what is happening. It's a willingness to tolerate it. It's a willingness to have it be this way for a period of time because it is. And so there's this acknowledgement of the reality of the situation, which is a really important part of anti-denialism. Like, we don't want to like live in denial that this is happening, because you need to participate in the treatment, participate in the treatment planning. And so this is also where caregivers can be helpful in sort of saying, okay, this is what it is, and this is how we're going to deal with it. Without feeling like you know, there's fight in that too. You can have both. You can at the same time accept the reality of a situation that's unpleasant and unwanted, and continue to fight for the future, fight for your health, fight for your loved ones. You can have both of those at the same time, and reminding people of what's important. Like, why go through it? Why put yourself through that, unpleasantness when it comes to the treatment itself, which I know for many people is worse than the actual, disease. So why would you do that? Well, because what's on the other side of that is important, and to not lose sight of that.
We talk about attitude a lot in terms of when we're going out and talking to not just cancer patients, but just kind of spreading the word about what we do and our mission. I guess that kind of, in a way, circles back to this time of year. And we talked about this. You did a study that involved generosity and how the human nature that evolves from that. Fourth quarter for us is big in setting up the next year as a foundation. Partnering with corporations, partnering with individuals. Individual giving obviously is big this time of year. Talk to us a little bit about the generosity piece, the study that you've done, and what kind of what you uncovered through that.
Okay, I'm going to set the record straight. It's not my study.
Okay, go.
I didn't do the research. I read the research, and I'm going to translate the research as best I can, as best as I understand it. But and there's actually multiple studies now looking at the role of generosity or the impact of generosity, and what we know based on some of these studies is that generosity is a mindset or an attitude. So speaking of that, there's intentionality behind it. So it's a purposefulness or a choice that I'm making to do this. It's not sort of accidental, or if it just happens. Like, there's to really achieve the benefits of giving, it has to feel like it's sort of a choice that you're making in a very intentional, purposeful, and meaningful way. So that's important. We also know that it feels good. It actually feels good. It actually lights up the parts of the brain that are associated with reward. So and I don't know, I read somewhere that it's the same as sort of doing like drugs. Like, it lights up that same part of the brain. I'm not sure if it's exactly that good, but it's it's the same part of the brain. So it lights up those reward pathways, which is interesting because it makes this case for an evolutionary advantage for pro-social behavior. So what does that mean? It means that we are hardwired for this, and probably for a really good reason, that our ancestors needed to be generous with one another, or be pro-social as opposed to anti-social. Like, there's a reason that we're social creatures, and there's a reason why giving is so important for as an evolutionary advantage. That's really cool. And then it's also really good for your physical health, your mental health. It's associated with like longevity, better immune system response. It's associated with greater life satisfaction, less stress. People who give tend to be also very optimistic and happier. They report higher levels of happiness. There's a bit of a chicken and an egg situation there, which is it the giving that makes me feel those things? Or do I already kind of feel those things and that makes me give? And it's probably a combination of both of those.
And I think, to clarify, this isn't just giving financially. There's other ways of giving. And we try to talk about this as well. Like, we mentioned earlier, we have events throughout the year. Well, those events just don't happen on their own without human bodies there volunteering. The impact that volunteers make of their time and manpower is huge.
Yeah.
And we have a couple events that require several volunteers.
Yep.
Without those volunteers, there's no event.
I think Team Joey specifically, one of those ones that I think anyone that you talk to that participates in those Lego givings to the kids at Paint Maine's Children's Hospital just come out of it just like, it's a different experience, and you're there helping, seeing the faces and all that kind of stuff.
Yeah.
So,
I talk to people, they're like, I feel selfish. Like, it feels selfish because this feels so good for me to have given of myself for this. But absolutely, it is not just money. In fact, in many ways, I think it's beyond money that really makes the most impact on a person, which is, volunteering your time, your body, your energy, which, for many of us is limited.
Right. Speaking of the mental aspect of this, that example was perfect because we talk about, we have a pediatric component that he mentioned, which is called Team Joey, and encourage people who have not been to go on a Lego give because some people have an issue with seeing sick kids, and that's fine. Whatever floats their boat. That's something that they don't want to do. That's fine, but. I try to encourage people to do this because when you go in and you see how it brightens up their day, not just the child, but maybe the family that's sitting there. There's one example that really stands out. This kid, we usually take characters with us, so some of us have put on costumes of whatever, and it just happened to be, I don't know if there was a Minion movie out or something, but we had a Minion character with us. Walking around, we walk in this room, and the child that's in the bed has like a Minion T-shirt on and one of those like Minion goggles, and I'm like, oh, this is perfect. Literally, when that Minion character walked in, everything changed. The kid just was like, oh my god, and put the goggles on. Like that picture we've used a lot. If you're an innocent bystander, if you will, it's a volunteer just kind of going around handing out the Legos, but you see that happen, if that doesn't make you feel good or inspire you to continue doing this, I don't know what will. It was a pretty cool moment.
Yeah.
Well, Natalie, you kind of went into this a little bit, but what is your cancer story?
I think the cancer stories that I remember and that have left an impact on me are the patients that I worked with when I had the opportunity to do that. I've also worked off and on with both providers and patients at Dana-Farber Cancer Institute. It's affiliated with the Brigham and Women's Hospital in Boston. And their stories and all the stories are just like fascinating, but also unique and special in their own way. And you're right. Sometimes it is hard to sit with somebody who is sick, and to not then sort of think about yourself and how fortunate you are to not be going through that at that point in time. But then all of a sudden you're like, it's not about me or where I am. It's me being fully present with this person, and giving of my time, my attention, and my skill to them and to assist them in this process or their journey. It's really just very impactful, and honestly, sometimes those are the most uplifting conversations, which may seem like counterintuitive, but some of the most uplifting conversations that I've had with people are those that are going through their cancer journey.
Yeah. Have you, reflecting on that versus what you're doing now, do you see a difference in someone's mentality going through cancer versus a normal patient, or someone who's come to you, had cancer in the past and then now is coming back for other reasons or anything?
It definitely becomes a part of their story as a person, what they've gone through and how they've incorporated that sometimes like as a part of their identity. Like, this is a part of who I am now. And that can be both like a good thing and then sometimes just a not so good thing if it becomes like an over-identified part of a person. So this is mostly me, which, it's not. It's a part of you. It's a part of your story and it's a part of your experience. But there's so many other parts to a person, so many other aspects or facets to a person's life that are outside of that. Yeah. And I think I've seen this happen where people become overly identified with their diagnosis and forget that there are parts of them that are separate from that. And And this happens with folks who have all sorts of different chronic conditions or chronic illnesses, including psychiatric diagnoses as well. And there's some similarities there between how much people identify with their diagnosis, and in some ways that can make treatment a little bit more difficult because it's a part of them.
Yeah.
I'm curious how many people have that same, I'm going to say issue, not just during treatment, but beyond. 5 years, 10 years out, are they still living with some sort of, I'm going to call it mental block, about having gone through this experience, whether it's survivor's guilt or whatever, that they might need some help with.
Yeah. So, I mean, I think there's something to be said for claiming cancer survivorship. Of course, I think that's huge. But I would want for somebody to consider all the other aspects of like who they are and the other roles that they play and the relationships that they have in their life. And this is an important one. But also consider the ways in which your life has been shaped in positive ways because of the experience. It doesn't only have to have been a negative experience. In fact, that's what resilience is. That's the kind of teaching and training that we do to make it matter. You know, if this is something that you have to go through or you had to go through for whatever reason, make it matter. Like, what are you going to do with that now?
Yeah.
This is where we give it meaning. This is where, if there's often the process of grieving that goes along with this, with receiving the diagnosis and then coming out on the other side, the things that you've lost, the health or the goals that you had, and it's adjusting your mindset from the things that you have lost to the things that you have gained. And there's sometimes they're a little bit harder to see, but they're always there.
Yeah.
Very cool. Any parting words of wisdom?
Well, I think about health in a very holistic way. So mental health, physical health, social health, spiritual health, it's all connected. So anything that you are doing to take care of your physical health is going to improve your mental health. Anything that you might be doing to improve your mental health is going to impact your physical health, whether that's generosity, whether that's the practice of compassion or gratitude, all the things that we know facilitate flourishing in a person's life. And anything that we're doing in the pursuit of happiness is going to impact your body physically and your relationships socially. So it's all connected.
Yeah.
So pick a point and start anywhere.
Yeah.
And then you'll see.
Awesome.
Cool.
Well said.
Yeah.
Well, thank you for joining us. We appreciate it.
Thank you so much for inviting me. It was great to speak with you.
Yeah.
Likewise.
Yeah.
And thank all you guys for tuning in to this episode of the Summits Podcast. Thank you for joining in from wherever you get your podcasts, or if you're tuning in on the Heroes Foundation YouTube channel, thank you for doing so. By the way, if you are on YouTube, haven't hit that subscribe button, please click it. Won't cost you a dime. It'll make you feel really good, I promise. And then hit that notification bell icon so you can be alerted when new episodes like this one drop. Also, and then hit those endorphins and gets you excited for the new episode. All right, guys, thanks a lot. And don't forget, beat cancer.